COVID cases are on the rise again in the U.S. This recent increase has some people concerned about another surge of the virus. Dr. Steve Threlkeld is an infectious disease doctor with Baptist Memorial Healthcare. He's here to talk to us about it. Thanks so much for joining us.
Thanks. Good to be with you.
Talk to us a little bit about why it is so concerning right now about this recent uptick in COVID cases.
Well, what we would love to happen is for COVID to settle in like a little bit more like the flu and be sort of a steady year-to-year variation where we could catch up with a vaccine, but it really hasn't settled into that yet. It still has some significant changes that it undergoes. And when it does that, it outsmarts, at least temporarily, our immune system, which can cause a large sort of array of cases like we're seeing now. Hospitalizations have essentially doubled or higher. It's still much lower than what we're used to with some of the Omicron waves, that sort of number, but it's still significantly up from what we've seen. And when you get that many cases, you're going to see a few people who are hospitalized and unfortunately even a few deaths.
So the cases that we are seeing, is this the cases that we were seeing at the beginning of the pandemic, or is there another variant? Because we've seen or heard about so many different variants of this virus. And what are you seeing mainly right now?
Yeah, it can really get confusing. We're still in the Omicron family of viruses right now, and they have moved even since we made a vaccine against an Omicron variant that's coming out here in the next week or two, actually. That vaccine, the newest vaccine booster, there's been one Omicron variant that's overtaken even that one. Thankfully, it's still going to be well protected by this vaccine. But even as we say that, there's a brand new, much different variant that's shown up in the United States and a few other countries, still very small numbers. It's not responsible for the numbers we're seeing now, but it was worrisome because there's so many changes. It's a much different virus. Thankfully, the very early returns on this do not indicate that it's going to be a lot worse or really do as badly in outsmarting our immune systems as it might have. But it's still a situation where this virus has some tricks up its sleeve, and we still have to be very careful to try to stay ahead of it to prevent these surges.
And you mentioned being careful. How can people be careful, and what are your suggestions on preventing getting sick from this virus right now?
Yeah, I think the very most important stuff is really the common sense stuff. We need to protect those people who everybody's used to knowing about now, the elderly, people who are pregnant, people who have heart and lung underlying medical problems, diabetes, or people who are immunosuppressed. They may have an organ transplant, they may be on some medications for autoimmune diseases like lupus. All those people we have to be careful about because they don't respond to vaccines and the like as well as the rest of us. Or they're also at such high risk for even milder disease with the heart and lung problems. So we need to protect those people, both by keeping their vaccine as up to date as we can do, and to try not be around those people when we're sick. It's important for all the controversy about masks through the years, and it took us way too long to learn about masks. We didn't do good studies about it, but what we did learn is that one of its chief roles is keeping you from giving COVID to somebody else. So it's helpful to have a mask on if you're going to be around those people who are at high risk, and particularly if you have any kind of respiratory symptoms. Don't go to work sick, and certainly not around people who would be at high risk. If we just do those things alone, those common sense things, we can really go a long way toward preventing serious disease and death left over in this virus.
And you mentioned right now we are seeing more of the Omicron variant of this virus. What about the rising EG.5 or EG5? You can correct me on that, that subvariant. Are we seeing that right now, and is that something that we should be highly concerned about?
Well, we are. That's really overtaking some of the viruses that are in our communities now, and those numbers have increased, but still protected against, thankfully, by this vaccine that's about to come out. It's still going to be helped a great deal at preventing really any infections in the short term and serious infections in the longer term. The one I mentioned earlier is BA.2.86, and that's way different even from the one you mentioned, but there's not much of that in the country yet. So we always have to be looking to try to stay ahead of this virus. We do it to some degree in flu every year. Our vaccine changes every year with influenza. We try to guess and make up the right one. And to some degree, that's with COVID as well. The vaccine that we're going to get in about a week or two at our pharmacies is going to direct against the one before what we're actually experiencing right now. But thankfully, they're still in the family to where that vaccine is going to still do a good job against what we see circulating in the community right now, even as it kind of ever changes.
All right. Thank you so much for joining us and sharing with us more about the COVID-19 virus right now, Dr. Threlkeld.
Thanks. Good to be with you.